about a third of adult mental health problems can probably be attributed to adverse experiences early in the life of a child. So the scope for prevention and the science of prevention that's emerging around this is really very powerful.
Within Karitane, we've got a plethora of people who are involved in the infant mental health, and this match is about bringing all of those people out and bringing them together to really explore where Karitane sits in relation to infant mental health and help us move forward and get some direction in where we need to go that's not just coming from in-house but coming from the experts from around the country.
I would be really interested to hear about the diversity of different approaches and programs that are offered to families in that early intervention space and how that might inform what we can do in New Zealand as well.
I think actually there is a lot of undeniable evidence about the importance of the early years and the way that adversity early on has long-term costs and long-term economic impacts. You know, that if you can prevent things early, you're saving money right across the board in terms of, particularly in terms of the health and the justice system.
So for us it's an opportunity to think about innovative ways to develop and deliver the kind of services that we know that parents with young infants and young children need to manage.
We're working with parents and we're thinking about infants and young children, but we're also thinking about the way in which both risk and resilience get passed on in families. And parenting, child rearing, early relationships are a really big component of the way in which that resilience and strength and health and well-being as well as vulnerability are passed on.
What's good about this match and meeting up is that we're getting the leaders in perinatal and infant mental health from Australia, New Zealand and from other places to talk about what's really worked.
And the expertise in the room is really huge and a wonderful thing to be part of.
But overall it was really great to be able to meet in this way, to bring perinatal and infant mental health into the International Initiative for Mental Health Leadership kind of orbit, and to really hope that this is the first of a number of ongoing meetings.